I'm Dr. Di Lawrence, Chief Medical Officer at Salin and clinician paediatrician. What matters to you is a really important improvement piece of work that we want to launch and share with you. It's a significant shift in what previously has been a medical model around what is the matter with you to what matters to you, so that we truly partner with our patients to find out what actually matters to them in their care journey. As we take this goals of care into all of our clinical areas, I particularly want to thank the steering group and the leadership group that have been working on this project for more than 18 months. They've done an incredible job at really engaging with many clinicians across Salin and particularly our consumers. We've had many consumer forums, consumer groups, partnering with Consumers Advisory Committee so that we really have heard that both the consumers and the clinicians to come together to design this work together. I'm really proud of the work and I'm really proud to be leading this work in Salin.
I think early in this journey of developing this Goals of Care program for Salin, we had lots of conversations with consumers, and trust and safety were the themes that just came out over and over again. Some of the really simple things to do are to sit and talk to your patient, not stand over them. Ask a patient what their preferred name is, know what their family situation is, and not just ask it, but use it in your ongoing conversations so that patients know that you know them as a person, not just as a patient in a bed number.
So that kind of understanding about what matters to you is really an important part of being a good doctor. You've got through that and have worked out what it is that's really important to them, then people really feel heard and they feel like you understand them, and that really helps with rapport building. And you can do it pretty quickly. It doesn't have to be a long conversation.
It is much harder these days with wearing PPE and masks and goggles, and so the onus is on us as the clinicians to really work that little bit harder and be able to do our best to make sure that our patients see that we are listening to them, even though there is a bit of a barrier now with all of the things that we have to wear. It is really important that we show that we are interested in getting to know our patients, and I think what's really important is that doesn't matter if you're meeting that patient just for the one time, for example in an emergency, or if you're looking after them on a ward, in a subacute ward where you might be seeing them for a number of days or weeks. It's really important that any interaction we have with our patients is a connected one, and one that gives an opportunity for them to ask us questions as much as it is us asking them questions as well.
I think the most important thing is just to be aware of how important it is, how invaluable it is, and how much it could change someone's life. So just start it the best you can, really. Well, we talk a lot about how we're going to train people to do this. So we could all sit around for hours and we could come up with a checklist that says, right, number one, you will say this, you will do that, you will do that. And that might work. But what if you're not the kind of person who could deliver that? What if you're not the kind of person who could respond well to those little questions? Just ask them. What's important, you know? What would you like to see? What can we do? How can we help? There's just whatever the person who's asking the question needs to ask it in a way that they feel comfortable. Otherwise, it's not going to come across as genuine for a start. And if they're tied to a specific little scenario that they have to use and they're not comfortable with it, well, in time that just might drop away. I don't like doing it. I don't feel good doing it. It's just understand the value of it, I think, and get into it.
Introduce yourself. I'm Marty. I'm one of the doctors. I'm here to help you. What is the first thing I can do for you now? Then that gives them the opportunity to say they have pain, they need pain relief, but it also means that they have an open environment where they can engage with you.
First thing is always asking like open-ended questions. As soon as you close down into direct questions, then they can only answer that question. I think sometimes at the end of it, if you kind of summarise what they've told you, you can then let them know that this is what I've gained from what you've told me, and actually if they want to add anything onto that, that is important to them. It makes it easier for them.
I think probably my advice would be, if you're hesitant or you don't know how to phrase something correctly, just have a go.
It is worth taking that extra minute. You know, it might be 5 minutes more of your day sticking around, talking to a patient and just figuring out what actually matters to them. And if you come back as that one person who stands there, chats to them, and really listens to them for, it might only be 5 minutes, you can make a difference in their care and really help them achieve their goals.
I think it is knowing about your patient first, and I think it's really helpful if we're using tools such as the Sunflower tool, just to get a bit of an idea of that person and their background, and that gives you some tips perhaps as to what might matter to them. If you have the opportunity to speak to family members as well, we can understand from them what might be important, and also acknowledging what's important to families may not always be the thing that's important to our patients. So it's not assuming that just because someone has a cognitive impairment that we can only get information from other people. It's about doing our best to connect with our patient. And it may be some very simple things that we might not think about that could be important to them.